Everybody, you are on a Dr. Y channel, and I am Dr. Armen, Professor Armen Astvatsadrian from Yerevan, Armenia. So actually I find very interesting question in your tickets concerning hematology. So if I read the question, it's like this: anemia, classification, iron deficiency anemia, B12 and folic deficiency anemia, hemolytic anemia, diagnostic, differential diagnostic, treatment, prevention. So anyway, this is a question so we have to answer. Of course, if I will answer in complete manner, I will not finish. But anyway, okay, let's go. My dear friends, dear students, take your pens, papers, have your seats comfortably, maximum. And let's go. Don't forget to make the notes. Okay, let's go. And let's start with the definition. So what is anemia? Anemia is a medical condition characterized by a decrease in the number of red blood cells or a decrease in the amount of hemoglobin in the red blood. In the blood. Red blood cells are responsible for carrying oxygen from the lungs to the body tissues. So decrease in their number or function can result in a variety of symptoms such as fatigue, weakness, shortness of breath, pale skin, etc. There are many different types of anemia with different underlying causes. Some of the most common types include iron-deficiency anemia, which is caused by a lack of iron in the body, vitamin-deficiency, which is caused by a lack of the certain vitamins, such as vitamin B12 or folic acid, and anemia of chronic disease, which is caused by underlying chronic conditions such as inflammatory disease or cancer. Treatment of anemia depends on the underlying cause and may involve supplements, changes in diet, medication, or other therapies. So actually, concerning classification, anemia can be classified based on the various factors, such as underlying cause, the size and the shape of the red blood cells, and the hemoglobin concentration in the blood. Okay, let's go. Based on underlying cause, iron deficiency anemia, vitamin deficiency anemia, as we mentioned above. For example, B12 deficiency, folate deficiency, anemia of chronic disease, hemolytic anemia, where red blood cells are destroyed prematurely, aplastic anemia, where the bone marrow doesn't produce enough red blood cells, sickle cell anemia, where the bone marrow doesn't produce enough red blood cells, and based on the size and the shape of red blood cells, microlytic anemia, normocytic anemia, based on the hemoglobin concentration in the blood, mild anemia, moderate anemia, and severe anemia. So actually concerning microlytic anemia, thus when we talked about, yes, understand. Explication. So okay, so based on the size and the shape of red blood cells, classification. So microcytic anemia. I'm sorry, it was my fault. Microcytic anemia, smaller than normal red blood cells. Macrocytic anemia, larger than normal red blood cells. And normocytic anemia, normal size red blood cells. So once again, classification based on the size and the shape of red blood cells. We've got microcytic if you want, micro and macrocytic anemia, and normocytic anemia. And finally, based on the hemoglobin concentration in the blood, mild anemia, so hemoglobin levels slightly below normal range. Moderate anemia, hemoglobin levels significantly below normal range. And finally, severe anemia, hemoglobin levels very low and potentially life-threatening. So the classification of anemia is important in determining the underlying cause and the appropriate treatment plan. What is iron deficiency anemia? What is iron deficiency anemia? Iron deficiency anemia is a type of anemia that occurs when the body doesn't have enough iron to produce hemoglobin, which is the protein, as we know. Hemoglobin is a protein in the red blood cells, erythrocytes, that carries oxygen to the body tissues. Iron is an essential nutrient that body needs to make hemoglobin. So when there is not enough iron in the body, the bone marrow is unable to produce enough red blood cells. No, obviously. Hem iron. Huh? Yes. Iron deficiency anemia is one of the most common types of anemia, my very Indian friends, and it's caused by a variety of factors, such as, of course, my dear vegetarians and vegans friends, inadequate iron intake. This can occur due to a diet low in iron, especially in vegetarians or vegans, or due to poor absorption of iron in the digestive system, blood loss, chronic blood loss, such as heavy menstrual bleeding, or bleeding in the digestive tract can deplete the body's iron stores over time. Increased iron demands during pregnancy or periods of rapid growth, such as in children. The body's iron needs increase and may not be met through diet alone. Symptoms of iron deficiency anemia may include fatigue, weakness, pale skin, shortness of breath, headache, dizziness, cold hands and feet, and chest pain. Treatment typically involves increasing iron intake through diet or supplements and addressing the underlying cause of iron deficiency, such as treating having menstrual bleeding or addressing any digestive tract bleeding. B12 deficiency anemia and folate deficiency anemia are two common types of anemia that are caused by a lack of vitamin B12 and folate, respectively. Both vitamins are essential for the production of red blood cells and the synthesis of DNA, so a deficiency in either vitamin can lead to anemia. The deficiency in either vitamin can lead to anemia, B12 and folate. B12 deficiency anemia can be caused by a variety of factors, such as inadequate dietary intake of B12, found primarily in animal-based foods, malabsorption of B12 due to digestive system disorders such as Crohn's disease or celiac disease, or conditions that affect the stomach lining that produces intrinsic factor, a protein needed for B12 absorption. Symptoms of B12 deficiency anemia may include fatigue, weakness, tingling of numbness in the hands and feet, difficulty walking, and mood changes. Folate deficiency anemia is caused by a lack of folate, which is found in leaf green vegetables, citrus fruits, beans, and other foods. Yes. It can also occur due to poor absorption of folate in the digestive system. Certain medications that interfere with folate metabolism or increased folate requirements during pregnancy or period of rapid growth. Symptoms of folate deficiency anemia are similar to those of B12 deficiency anemia, and thus include fatigue, weakness, headache, irritability, and shortness of breath. Both B12 deficiency anemia and folate deficiency anemia can be treated by increasing the intake of these vitamins through supplements or dietary changes. It's important to identify the underlying cause of the deficiency and treat it accordingly to prevent further deficiencies. Hemolytic anemia is a type of anemia that occurs when red blood cells are destroyed or removed from the bloodstream before their normal lifespan is over. This is hemolytic anemia. Normally, red blood cells have a lifespan of about 120 days before they are broken down and removed by the spleen and liver. However, in hemolytic anemia, red blood cells are destroyed prematurely, leading to a shortage of red blood cells in the bloodstream. Hemolytic anemia can be caused by a variety of factors, such as inherited genetic disorders, for example, sickle cell anemia, thalassemia, autoimmune disorder, where the body's immune system attacks its own red blood cells, infections, for example, malaria, certain medications or toxins, or physical trauma to red blood cells as they pass through narrow blood vessels, for example, in cases of blood clots of heart valve abnormalities. Symptoms of hemolytic anemia may include fatigue, weakness, jaundice. Jaundice is a yellowing of the skin and the eyes, dark urine, and enlargement spleen. Treatment depends on the underlying cause of the anemia, but may include medications to suppress the immune system. In cases of autoimmune hemolytic anemia, blood transfusion, for example, in cases suppress of the immune system, in cases of autoimmune hemolytic anemia, blood transfusions to replace the destroyed red blood cells, or surgery to remove the spleen, in cases where the spleen is overactive and removing too many red blood cells. In some cases, hemolytic anemia may be chronic or lifelong, and ongoing treatment and monitoring may be required. So diagnosing hemolytic anemia typically involves a combination of medical history, physical examination, blood tests, and sometimes additional diagnostic testing. Yes, blood tests are typically used to evaluate the levels and characteristics of red blood cells in the bloodstream. These may include the complete blood count to measure the number and size of red blood cells, as well as tests to assess the level of hemoglobin, hematocrit, and reticulocytes, immature red blood cells, immature. Additional tests may be ordered to identify and any underlying causes of the hemolysis, such as autoimmune disorder or infections. So this is about diagnosis. About differential diagnosis of hemolytic anemia, involving distinguishing it from other types of anemia that may have similar symptoms of blood tests. Blood test results, for example, iron-deficiency anemia is the most common type of anemia and can cause fatigue, weakness, and pallor. However, if we compare, unlike hemolytic anemia, iron-deficiency anemia is caused by a lack of iron rather than destruction of red blood cells. Anemia of chronic disease. Anemia of chronic disease can occur in patients with long-term chronic illnesses, obviously, such as, for example, cancer or inflammatory conditions. Once again, my friends, out of topic. Any disease is inflammation. Okay, it can also cause fatigue, weakness, and pallor, but it's caused by a combination of factors such as inflammation, impaired red blood cells production, and impaired iron utilization. Megaloblastic anemia is caused by a deficiency of vitamin B12 or folate and can cause fatigue, weakness, and pallor. However, is characterized by large abnormal red blood cells on blood tests rather than the destruction of red blood cells seen in hemolytic anemia. Hemorrhagic anemia occurs when there is a significant blood loss due to injury, surgery, or a bleeding disorder. It can cause fatigue, weakness, and pallor, but it's caused by blood loss rather than destruction of red blood cells. So distinguishing between these types of anemia is important in order to determine the most appropriate treatment and management plan for the patient. Concerning treatment for hemolytic anemia, depends on underlying cause of the condition. In case where the anemia is caused by autoimmune disorder, medications may be prescribed to suppress the immune system and prevent destruction of red blood cells. In some cases, blood transfusions may be required to replace the lost red blood cells and improve oxygen delivery to the body's tissues. If the anemia is caused by the medication or toxin, discontinuing the medication or removing the toxin from the body may be necessary. If the anemia is caused by inherited genetic disorders such as sickle cell anemia or thalassemia, management may involve ongoing monitoring of the patient's red blood cells counts, and transfusions are needed, as needed. In severe cases, bone marrow transplants may be considered as a potential cure. Prevention of hemolytic anemia depends on the underlying cause of the condition. For example, certain types of hemolytic anemia caused by infections such as malaria may be prevented by taking preventative medications and avoiding exposure to infected mosquitoes. We're talking about prevention. Hemolytic anemia caused by autoimmune disorder may be prevented by managing the underlying conditions and following a treatment plan prescribed by a doctor. In some cases, lifestyle changes may also help prevent certain types of anemia. For example, healthy diet that includes both foods rich in iron and other nutrients necessary for red blood cell production can help prevent iron deficiency anemia. Thus, avoiding exposure to toxins and harmful chemicals may also reduce the risk of developing hemolytic anemia caused by toxins and or medications. So, largely enough. Largely enough, I don't think so that we will ask you in this manner the questions, but anyway, the answer is like this. So, thanks for your attention, my dear friends. See you in another lectures. Don't forget to follow and subscribe. Re-listening these videos, why not with your headphones? Up to you how to. With podcasts, I don't know what. Re-listening several times to understand the topic. Please. See you in other lectures. Bye-bye.